Hi, everyone. Today I'm joined by Dr. Rose Jones, a medical anthropologist and climate and public health policy strategist, whose work sits at the intersection of climate change, public health, environmental justice, and community advocacy. Dr. Jones has built a career spanning academic medicine, community-based research, public health, and science communication. Her research has examined everything from medical education and health communication to climate change, extreme heat, and the lived experiences of communities facing environmental health risks. Today, Dr. Jones is the founder of Rapid Anthropology Consulting, where she works at the intersection of climate, health, equity, and human rights. She's also vice president and co-chair of the EcoHealth Texas Committee at the Texas Physicians for Social Responsibility, where she works on climate resilience, environmental health, and evidence-based policy. She's the executive director of the HAQ App, a climate health tool designed to connect people with real-time information about heat and air quality and resources that can help them respond to environmental health risks. Dr. Jones, thank you so much for joining me here today.
Delighted to be here and appreciate the opportunity.
Absolutely. So let's just start from the beginning. Can you just tell me about your formative experiences in academics and how that kind of brought you to where you are right now?
Absolutely. So I planned to be an attorney. That's what I worked on in my undergraduate degree. And then literally my last year, fourth year in undergraduate school, I took an anthropology course. It was something I wasn't necessarily interested in, but needed it to graduate. Quite literally, I walked out of the class and knew that I wanted to be an anthropologist. It was truly that phenomenal of an experience. So I decided to marry an attorney and to go to grad school and become an anthropologist. I applied to three, I think this part is interesting. I didn't really know what I wanted to do, but I applied to three graduate programs, one of which was at SMU. I'm from New Orleans, so I was interested in leaving the city for my training. And SMU offered me a full scholarship to be a medical anthropologist, so off I came. And I did my doctoral work in the Caribbean, focused on, it was early days of HIV/AIDS. So I was interested in looking at how AIDS was emerging as a new disease and how we could help the biomedical community and the cultural communities to bring messaging and to address what was at that time, we had no medications, we couldn't even test for HIV/AIDS. After I completed my doctoral work, I returned to the United States and took an academic position at UT Southwestern Medical School, assistant professor in the PA program, and I spent half of my career in academic medicine. I was a research scientist at Children's Hospital, at Parkland, focusing on issues of not just training students in didactic lectures, but also doing research that was very specific to looking at equity and communities that had really been marginalized. The last half of my career was really dedicated to working more in the community itself through a variety of nonprofits. I worked at the Salvation Army, helping them to build a research and evaluation department following COVID. I did work with domestic violence, so really just sort of more boots on the ground type of work. And then toward the end of what I thought was going to be my career, I had my eye toward retirement. I was approached by a small nonprofit tree company in Dallas. They've been around for 40 years. They had a really stellar program using nature and trees in particular to help mitigate urban heat islands. The CEO approached me and said, I want you to come on board because I want to create an anchor for public health for all of the green programs that we have. And honestly, quite frankly, I told her no several times. And the reason for that was I had never done climate health. I didn't really know much about it. Most of my work had been with infectious disease or, again, working with the community on a variety of primary healthcare issues. But she was very persistent. And I thought, well, maybe this is where I'm supposed to be. And so off I went and spent 2 years looking at climate, specifically heat. And that's how I became interested in the work I'm currently doing.
What a journey. And that's so amazing that you started off in anthropology and then worked your way to climate and health. Earlier, when I was on a call with you and your colleague, Dr. Marcia Priors, you guys were speaking about your upcoming project with field zines. Can you tell me more about that and any other projects that you are currently working on and are very excited about?
Absolutely. So field zines is something that I'm very passionate about, really excited. We'll be launching it in the next few weeks, hopefully. It's a project that really sort of emerged based on Marcia and I's experience together. So we're both anthropologists. We met in grad school, and we both went our respective ways to do field work. I went to St. Lucia to look at HIV/AIDS, and Marcia went to Jamaica to look at domestic violence. We came back to Dallas and life kind of intervened. We went our separate ways, families, careers, that type of thing. And about 2 years ago, we were both at a university lecture, a lecture I normally would not have gone to. And we looked across the room and saw each other after almost 30 years. And it was as if those years had evaporated. So we began meeting for lunch and dinner and happy hours. And during that time, we began talking about what it felt like to live in this moment, right? And we began talking in earnest about what we were noticing and why anthropologists were not more involved in what was happening. We were looking at immigration raids, we were looking at political violence, we were looking at extreme heat, we were looking at workers who were trying to adjust to climate when the institutions weren't ready or responsive. And we were watching people develop a new language of how they talked about climate change, everything from Coachella cough to heatflation. And we realized after talking and working in the space for a while that we were actually doing anthropology almost unintentionally, right? And so what we decided to do was how can we make a contribution? What can we do at this specific moment? And so we came up with the idea of field zines. Field zines are our effort to take anthropology out of the academic institution and bring it more aligned in this moment in time in the real world, if you will. So they're essentially small pockets of ethnographies designed to speak to this moment. We're calling it our byline is at this point, two lone anthropologists in the Lone Star State. So hopefully we will be able to make some traction with some of these really big issues that we're all dealing with.
That sounds so incredible. That's so exciting. And can you actually tell us a little bit about how climate change and heat can exacerbate existing health inequities?
Great, a good question, an important question. And the short answer is in inextricable ways. We have decades of data that show the impact, the dire impact that heat has on the human body. Literally every organ in your body is impacted by heat, whether we're talking mental health conditions, cardiovascular, pulmonary, GI issues, even reproductive issues. So we know that the hotter it is, the more intense the heat is, the more frequent it is, the more impact it has on the human body. And one of the things that I've been very interested in within this space is, in spite of that knowledge, we really have not moved the dial much in terms of, well, how do we address this? How do we mitigate this? So, for example, in Texas, we still have we don't have a solid understanding of what mortality and morbidity looks like for heat. We're not capturing that data, and the cities that are capturing that data have different definitions. They have different metrics that they're using. So we don't have a good sense of what that looks like. And that's sort of foundational for public health, right? You can't, if you don't measure it, you don't really know what the impact is going to be. The other issue within that context that's become something I'm very interested and committed to is public health messaging. We know that it's really important that you talk to community members and when physicians meet with their patients, that you're using the right concepts and the right languages that resonate with them for change. And if you step back and look at the messaging that we have around heat, for example, then the messaging is very generic. We tell people, stay hydrated. That is a word, for example, hydration is a word that's complicated and it can mean different things to different people. So it's pretty much public health 101. You have to understand how your community members use a term and what it means to them so that you can design appropriate interventions or public health messaging. The other messages that we see in public health are, stay inside during the hottest part of the day, stay cool. That doesn't resonate and it's not impactful for many of the people that are affected. Workers who have to be outside, people who are afraid to speak up and say anything to their boss. Texas now has House Bill 2127, and it literally has preempted cities from providing mandatory water and rest breaks for outside workers, construction workers. When you have heat, like for example, this week, 105, 106, and that's not counting the wet bulb flow temperature, right? Those are dangerous levels. So these are some of the issues that I think are really important and that we try to advocate through Texas PSR and through the community work that we do.
Yeah, and it's so incredibly important to be raising awareness about these things. I know there is a difference between indoor and outdoor heat. So, can you tell us a little bit more about that?
Sure. So one of the impacts for the extreme heat has been that we hear public health officials and city leaders say, stay inside if during this hot part of the day. We don't really have a lot of data on what that looks like in people's homes. We know that there are people who have substandard housing. We know that there are people who can't afford to run their air conditioner or may not even have an air conditioning, right? And so when you tell people to stay indoors without really understanding what that dynamic is, it can be really problematic from a public health perspective. And I'll give you an example. When I did my doctoral work in St. Lucia, again, in the early days of HIV/AIDS, one of the messages, the early messages that we told people was use a condom, right? And what I found in working on the island was that that message resonated fairly well with industrial countries like the United States. We had access to condoms, people knew how to use them and knew what the impact was, right? We had lots of public health messaging around that. What I found in the islands and other colleagues working in different parts of the world is that these were often resource poor communities. So when you're giving a message of using a condom and they don't have access to condoms or they can't afford condoms, what I was watching happen were people sharing condoms after they had been used. And that's the opposite of obviously what we want to do. And so I use that analogy because it concerns me that we continue to have these generic, ad hoc public health messaging about heat, for example, without really understanding what that means to people in communities.
Absolutely. And you've talked about the importance of lived experience and ethnographic data. So, what do you think communities can teach policymakers through this form of data collection that traditional data sets may not?
I think that it's super important to understand communities from their perspective. They're experts in their lives and in their communities, right? And the analogy that I would use is we often tell patients, you know your body better than anyone else. The same is true for living in a community and living with the challenges, in this case, environmental challenges that people in communities have. And so increasingly, what I find is that that voice, that perspective is not at the table. It's not being part of what we're doing for policy. Those voices are critical. And I spent a lot of time working on trying to be a bridge as an applied anthropologist to putting together, policymakers with community members, because that dialogue is foundational for any kind of change or any kind of impact that we're going to have.
Absolutely. And where do you think the biggest disconnect exists between scientific evidence and the policy world, advocacy space, and communities?
I'll say my answer today is probably different than it would have been a year and a half or 2 years ago when Trump came back for a second term. Now, what I'm seeing with the disconnect is we're seeing information, data that's been removed, altered, hard to access. Take data centers, for example. Increasingly, what we're finding is that it's hard to even know where these data centers are planned, what permits, if any, have been allocated. The data has become increasingly suppressed. So I think that in this moment that we're living right now, that is something that we all have to deal with. So I'd say misinformation, access to data, and my original point, which is bringing in the community and bringing in diverse perspectives for common solutions.
Absolutely. And what would you say is the reason why all communities experience climate related health risks not in an equal manner?
I think that that's very true for the perspective that anthropology invites, which is we know we're never going to have a one size fits all. And because people have different resources, access to resources, different experiences, different goals, different aspirations, and all of those have to be taken into account if we're going to have viable solutions. Too often what I see, especially at the policy level, is a solution has been raised, maybe or maybe not, typically maybe not, the community's been invited to participate, and then an agenda is set, right? And it's across the board. And that may not be relevant for an unhoused person. It may not be relevant for an affluent family living in the suburbs of Dallas. So I think that we need to continue to move in the direction of making sure that diversity is important in terms of scope and scale of problem, and that we devise solutions that are more holistic, systemic, and sensitive to the fact that we do have diversity in our communities and in our needs.
And what role do you think physicians, people in the healthcare system, what role should they play when addressing climate change and environmental threats?
One of the things that I feel really strongly that needs to change is the curriculum itself, whether we're talking medical school or nursing school. Too often, medical schools do not have any courses on environmental health. Oftentimes, what I find is that they have an elective course. So that means students may or may not take it. And of course, medical curriculum is quite complex. And oftentimes, the courses, if they are offered in the first year in a didactic. And without reinforcing the messaging while students are on preceptorships, for example, where they're learning from their mentors and they're applying the knowledge, that's probably not enough. So I think it's really important. Right now, what I see, I've been working in space specifically of heat and climate for about 4 years. And when I first started on this journey, there was very little dynamic or discourse or discussion about climate health in particular. It was very marginalized. What I see now, especially on social media, is I see a lot more health professionals talking about it, thinking about it, putting together groups. That's awesome. But that's not enough, right? To have just awareness. I think we need to have, we need to go in and change. Look, World Health Organization is on record to say that climate health is the worst disaster facing humanity for the next 100 years, right? And so if that's true, to relegate environmental health courses for one course or an elective is ludicrous. We need students who can be learning this information because they're going to continue to encounter it.
Absolutely. And when we have in just the political discourse major figures, discounting climate change and saying a lot of different things about it, how, I guess, do you confront that on a daily basis when you're working in the field? I'm sure there are people with many varying ideologies. So how do you deal with that? And what is your advice to, this next generation?
The short answer is I think we all need to practice courage. I think that we need to be standing up and talking about injustices, inequities, and telling the truth. That's critical. And I know that there's a lot of fear, there's a lot of uncertainty. People have jobs on the line. I hear this all the time, which is valid, right? but there are ways to work in the system. If we don't begin telling the truth and doing it authentically and really, that's what partly Field Zines was designed to do. Like, let's call this what it is. Then we're going to be stuck in this gear for quite a while. So I think that that's first. Practice, stand up, be accounted for. Don't be afraid to tell the truth. Find a way that you can bring authenticity to the work itself. Um, and I think the other battle embedded in that is, what is the truth? Where do we go? How do we know? And I can tell you, as someone who spent more than 30 years as a researcher, right? It's exhausting to try to research small pieces of information to make sure it's credible, right? Before you can even get to the analytical part or the policy part, just to try to establish what is a fact. It's exhausting, right? So I think that we need to be, working together to do that. I think that we need to have think tanks that can do that, and we've got some scientists who are working together to build new data systems that do have this empirical framework that's not part of the government, which again is trying to remove the information and the data and the statistics that we need to be able to do our work. So I think that that's really important. The second piece of that is, I think it's really important that we begin talking and meeting with and working with people who don't have the same opinion that we do, right? That is foundational for being able to make any kind of viable solution last. So one of the things that I found most encouraging in what I would otherwise describe as a very bleak world at this moment is what we're seeing happening along the border with Big Bend. We see in Texas, where it's been very polemic for many decades, quite frankly, but we're seeing this sort of coming together, Republicans, Democrats, old people, young people, tourists, natives, etc., because they don't want a wall built in the Big Bend National Park. And that has really been a galvanizing force, and it gives me hope because I see that we can work together. We can have different opinions and different experiences and still work for common goals. And I should say one quick thing, we're also seeing that same type of momentum, I think, building up with data centers, right? Data centers have, been able to raise and galvanize the same type of energy that we're seeing in Texas with Big Bend.
Yeah, absolutely. And for any young person watching this who wants to go into public health or environmental health, what would you say is the best things that they do? What advice would you give?
Give me hope. So that's always a good thing. I say, yes, I'm so happy that there continues to be, and the data shows us that there is an interest with young people continuing to move in this space. So that's really positive. Um, the world is very uncertain right now, and that includes universities, right? We've seen massive, not only budget cuts, but we're seeing programs either be eliminated or quite literally revisioned, right? And so there's uncertainty in that space. And then I think the other thing that's going to be really important as we move forward again in this uncertain world that we've all inhabited with increasing needs from a public health and an environmental perspective, I think it's really important for mentorships to transpire, for people who have been working in the field, who know the space, who know the issues to the extent that they can, working one-on-one. I think we need to do more of that. I think that's going to be really critical for young people to continue to move forward in this space. And I guess the other thing I would add, um, find something that you're passionate about. Like in my case, I spent 4 years ready to go to law school, and then one course changed my whole trajectory, right? Because I found something that resonated. It found something that lit a fire in my belly. So I think that that's true now as it was for me 30, 40 years ago, right? Is find something that, because this is a long haul, right? Um, and then I would say the other, from a more practical perspective, outside of just mentoring and finding internships and selecting courses carefully and strategically, I think the other thing to do is speaking in other languages really critical. I think that anthropology is foundational for having a holistic approach, learning the language, living in the community with the people that you're studying and working with. And I think that that messaging can go a long way to what we're dealing with today.
Yeah, that last one was very unique. So it was great to hear that. Thank you for coming on today. Really enjoyed having this conversation with you.
Greatly appreciate the opportunity. And I'm super excited that you're doing the podcast. I think this is a perfect moment in time. Good luck.
Thank you.